So I am Dr. Masuda here at JWP. I'm the naturopathic doctor. Today we're going to be talking about low-dose naltrexone. Right. So first of all, what is naltrexone? So naltrexone has actually been used for a long time. It was synthesized in 1963. And basically, it's a competitive opioid receptor antagonist. So what that means is that it's going to compete with opioids for the receptor. So what this is usually used for is alcohol or opioid withdrawal. So they would use this, with people who were tapering off of opioids or heroin addiction, things like that. So what it does is it blocks the opioid receptor without actually activating it, which is great, and it's comparable to naloxone, which some people might be more familiar with, but it's actually more bioavailable and it has a longer half-life. And so the dosage for this, which is just regular naltrexone, is about 50 to 100 milligrams. So low-dose naltrexone is about 1/10 of that, of what the usual use for naltrexone is. And that ranges from about 1 to 5 milligrams. Usually about 4.5 is the standard dosage. And so they realized that in about 1980 that they could use this really low dose and use it for something without getting the side effects that you get with the larger, more commercially available dosage of naltrexone. So they started using it for MS, multiple sclerosis, and then that really expanded pretty quickly into using it for HIV, AIDS, adjunct cancer treatment, autoimmune conditions. It's just like more and more things are finding that it works for. So there's a few different dosings for naltrexone. They had the commercial dosage for naltrexone, which we talked about, the 50 to 100 milligrams. They have low dose naltrexone, which is the main topic of today. Now, like I said, it's about 1 to 5 milligrams, and it's available in capsules. You can use creams, sublingual drops, liquids. So there's varying ways that you can get it. And we usually dose it at bedtime, anywhere between 9 p.m. to 3 a.m. because they found that one of the ways that it works is to produce endorphins. And the time that we do that the most is usually around 2 to 4 a.m. Some research shows a little bit later, but it's usually between 2 to 4 a.m. So this helps to boost that. There is also something called ultra low dose naltrexone, which is less than 1 microgram, like really, really tiny amount. And then very low dose naltrexone, which is anywhere from 1 microgram up to 1 milligram. So just to talk about those two briefly, ultra low dose naltrexone, it's used post-operatively when someone's coming out of analgesia to reduce the amount of opioids that they need afterwards, or reduce the side effects of the opioids, which is great. I have such a hard time saying opioids, so bear with me. And what it does is it acts on the new receptor signaling. Very low dose naltrexone. It's only used experimentally at the moment, but they've been using it to help with people who are tapering off of methadone, who are tapering off of opioids. So it's been helpful with that. Back to low dose naltrexone. Like I said, that's between 1 to 5 milligrams. So there's a few different mechanisms of action that have been proposed, and they obviously work together. One of them is the release of beta endorphins, and I talked about that briefly. So what it does is act on that receptor, the beta endorphin receptor, to release your endogenous endorphins. So that's your own endorphins. And they've even seen that after 1 month, like after you stopping the use of LDN, this is still happening. So which is really, really great. It has a slight analgesic effect. Obviously not as much as like the high dose, which is 50 to 100 milligrams, but that is slightly there. And like I said, this is the main pathway that we increase our own endogenous endorphins and opioids. The other way that it works is by reducing multiple pro-inflammatory cytokines. So cytokines are those guys that go one way or the other. Some are pro-inflammatory and some are inflammatory or anti-inflammatory. And really, our body is always trying to find a balance between those two. And so obviously when we're sick, if, in certain cancers, when we've had COVID, a lot of talk around cytokines. So what they found that when they did a study, about 8 weeks at this standard dose, which is 4.5 milligrams, it reduced all these different cytokines, some of the interleukins, granulate macrophage, colony stimulating factor, and TNF alpha, which are all pro-inflammatory. So those are the ones we don't want around. The last way is by regulating our opioid growth factor. So this is opioid growth factor is actually also known as a certain peptide called medenkephalin. And what they found is that the opioid, or I'm going to call it OGF, OGF and its receptor, when they're upregulated, it actually slows down tumor growth. So obviously, when they found this out, they're like, okay, let's use this in cancer research. So that's something that they've been doing a lot recently, using it as an adjunctive support in cancer care. Okay, the uses, like I said, this is being researched more and more and more. They've been trying it out, and you'll know why. I'll tell you why. For many different things for the past, like, I'd say like 30 years. You know, it's helpful for kids with autism, and usually we use some of the creams with them. Endometriosis, all the different autoimmune disorders like rheumatoid arthritis, Crohn's disease, Hashimoto's, even in post-COVID syndrome. So obviously that's been something new that they've been studying, but realizing that a lot of people have been seeing benefit from it. And like this chick here is saying, the list goes on and on and on. So I just picked a few of the main clinical uses, things that we see a lot, you know, say in our practice and just see in day-to-day life. Crohn's disease, which is an irritable bowel disease. And what they saw with the research that's been done with it, just overall improved quality of life. You know, Crohn's disease is an issue where you see a lot of diarrhea, abdominal pain, weight loss, malnutrition. So this improved their overall quality of life, and it actually lowered their inflammatory markers, which is like ESR, CRP. And then you actually, when they did endoscopies where they put the scope and they're looking at the actual GI tract, they actually saw mucosal membrane healing, which is huge for something like Crohn's disease, where that's what's happening, is it's, you know, attacking the gut lining. For cancer research, they've been seeing that it actually helps, LDN actually helps to prime the cells so that when you do have chemotherapy, it actually is more effective, which is huge. And in addition, something that we talked about earlier is that it upregulates that OGF and OGF receptor axis, the opioid growth factor, so that when that's upregulated, they actually saw a slowing of tumor growth. So it's been used in a couple different ways. They've been researching it with breast cancer, like triple negative breast cancer, which is really aggressive to treat. Improved outcomes with pancreatic cancer, which is something that, you know, is hard to find, and when they do find, it's usually at a later stage. So that is also huge in terms of research. Two other things that we see very common is Hashimoto's thyroiditis, which is an autoimmune condition where your body is creating antibodies that are attacking your thyroid. So what LDN is being used with this, and there hasn't been a ton of research behind the actual mechanism of how it's working, just more evidence that people have seen that it's been working, that they've been able to come off of medication. They feel overall better. It's bringing their antibodies down. And we think that this is due to reducing the chronic lymphocytic inflammation. So it's basically modulating your immune system. It's getting a handle on it. And like I said earlier, that has to do with the cytokines. You know, there's the pro-inflammatory ones and the anti-inflammatory ones, and it's all about finding that balance. If you want inflammation sometimes, but not all the time. So we think this is how it's working for Hashimoto's. Lastly, it's a similar mechanism for post-COVID fatigue, post-COVID syndrome. So again, this is all about immune modulation. You know, we've seen where people have got the virus or any, you know, a lot of different viruses, and they're just, you know, they have the initial sickness, but it's like their body is not processing that virus out very quickly. And the cytokines, just the inflammatory cytokines, just keep wreaking havoc in your body. So this is another way, another tool basically to help reduce that pro-inflammatory cytokine load. Okay, so there are a couple of contraindications. Obviously, if you're on opioid medications, you want to taper off of those first, since you are blocking those receptors. So really, there just be no point, waste of money, and also waste of the side effects that you get from the opioids. Second is candida, which is a type of fungus that can overgrow. We see it a lot of time in the gastrointestinal system. You know, signs would be abdominal pain, craving sugar, have like a white coating on your tongue. And this can also get to the rest of your system outside of your GI tract. So it actually blocks the LDN from working. So you want to make sure you treat that first, because with the LDN, you're tampering down that immune response. which is good in a lot of ways. But if you're tampering down the immune response and there's already candida there, that can allow the candida to grow more. So you want to treat that first. Some of the side effects, and it's very minimal because remember, naltrexone that was used initially, like that 50 to 100 milligram dosage, that's a much larger dosage and that will have some side effects with it. But because we're using such a small amount, like I said, up to the 4.5 milligram dosage, which is standard, the main side effects we might see is some insomnia. Vivid dreams is the main thing. Some people have nightmares, other people just say just very vivid dreams that are hard to discern from being awake and not. So that is the main thing. And other things, sometimes headaches and occasionally GI discomfort. But most of these can be mitigated by slowly tapering up. So usually it's starting very, very low dose at the 0.5 milligrams and then just dosing your way up very slowly until you get up to the 4.5 milligrams. And this is going to vary from person to person. It depends on why you're using it. With autoimmune conditions, we would raise it slowly, or more slow than other people. The other thing you can do is start dosing it in the morning if you're having insomnia or vivid dreams. But after a while, you do want to try and once you're up at the standard dose, you would want to switch back to the bedtime dosing because one of the whole points of doing it is to try to increase those endorphins, and that mostly happens between that 2 and 4 a.m. time. So, who is a good candidate for LDN therapy? People with autoimmune conditions. Sometimes when you've seen a treatment plateau, LDN can be really helpful just to shift, lower inflammation, introduce more endorphins. So that can be helpful in that point. And then as adjunct treatment, as I've talked about, most of these conditions, autoimmune conditions, cancer, things like that, this is always going to be adjunct treatment. And one of the reasons it's so good is that because it has such a low side effect profile. You're not going to get many side effects. So adding it on is not going to be, okay, I'm adding on another medication and now I'm getting all these other side effects that I have to worry about. Really low side effect profile and also low cost, which is also really really nice, and possibly why there isn't a ton more large studies being done on it because of lack of financial gain. Anyway. Then also, I like to use it for inflammatory conditions where there's low treatment tolerance. So, for example, if someone just has so much inflammation that they're not even really able to take other medications or supplements because it just aggravates so much and they just can't get to a therapeutic dosage, sometimes starting with LDN can be really helpful because it gets them to a point where they can tolerate the actual treatment. So yeah, I mean, it's like I said, it's got the low side effect profile, low cost, it's safe during pregnancy. We would usually just stop it in the last trimester, just in case they're going to be using opioids after delivery, which is common. It's safe for kids. Like I said, there's creams and sublingual drops and liquids and different forms of getting it in. And then lastly, there's, as of now, they've been researching LDN since 1980. No known abuse potential, and then no withdrawal symptoms, which is also another key part that people are asking about, because this is at the larger dose, there would be withdrawal symptoms, but with this low dose, there hasn't been shown to be any. And what I typically do is, have my patients on it for a while, and then you take a little holiday from it and see how you're doing with the reason that we started it, whether it's for an autoimmune condition, or a gastrointestinal issue, and then we see how you're doing. So really, it's been, a really nice treatment option to add on to different therapies because of that lack of side effects. It's not extremely costly, which is also really, really nice and really great for the patients. But a lot of people are good candidates for it and can really change their treatment and their outcome. So short and sweet today, but just got to the point. Hopefully they're going to start doing more and more research for this. So far, sample sizes have been on the smaller side, but outcomes have been really great. So hopefully we see more and more use of this. Anyway, okay, if you have any questions, please, feel free to contact us, make an appointment so we can see if this would be a good addition to your treatment. Yeah, thank you for listening.